Dr. Jacobs, I guess the most appropriate place to start for questions is from the student's perspective. And I guess the best question to ask is, what is curriculum mapping?
Sure. It is the right place to start. Mapping is different from old forms of communicating about what curriculum is for a couple reasons. Mapping asks teachers to reveal what they're actually doing in real time operationally in the classroom the course of the school year and share it electronically with all other members of their faculty. And also, as a result of it being electronic and web-based, they could also immediately find out what's going on in a building, say I taught in an elementary, what's going on in my neighboring high school, immediately. So it's immediate, it's authentic, and the reason is so that we can then make decisions about gaps, what we've left out, repetitions, to see if we're repeating things, are we aligning with standards that students need, and to just find out what the heck's going on in a building. You know, it may sound funny, but we're the only field, education's have been the only field that's been confused between what a guideline is and what's operational. If you were a doctor, you would be obliged to keep records in real time about precisely what care you gave a patient, what prescriptions you gave the patient, the state of the patient. And at the same time, you'd have guidelines. You could go to your shelf of books or go online and find out, advise you, and find out what might help you with a decision. But you're not confused about those two things. You know the difference between guidelines, which are generic, and the actual patients you have. So you might have 10 patients that have a common condition. Say they all have some stomach pain. They're all different. You can make different prescriptions. They're different people. If I'm the next doctor who receives your patients, I need to know precisely what you did, what you worked on, what you assess, how you assess them, what prescriptive actions you took in real time. In the past, Matt, we've never had that. All we've had in education were guidelines, and people made assumptions. Kids were actually experiencing certain things that they may or may not have. And I would throw back to you, I would bet you, if you look back on your experience, you can think of many times in the classroom where a teacher said, do you remember last year when you studied this? And you're going, we didn't get to that. Or, I'm going to introduce a new book to you. And you're going, hey, well, you read this 3 years ago. And those kinds of things happen all the time because there's been a confusion between a guideline and operational mapping, which asks us to make decisions with those maps. So it's a review process to review those maps and make better decisions on how to prepare learners. That's one level of the work.
So to analogize, a curriculum map is like when you visit the doctor's office, and it's like a history. They always say to stick with one healthcare provider because they'll know you from having cared for either your members of your family or yourself for a long time. So they know you well. They know that the medications that you've had before, the symptoms that you've had with certain illnesses, but they'll know particularly about you because they have your history. And it's by looking at this extended history, you understand better the patient and the treatment, or in this case, learning for the student.
That's somewhat holds true, but there's a little more to it than that. It's a good start, a real good start. In that, you can also take prescriptive action. And yeah, it's nice to stay with the same healthcare provider, but the truth is people move. And the truth is sometimes doctors come and go. And what we now have in the medical profession is, as you know, I know you have an interest in medicine too, is that it's electronic, it's computerized. If I move from, say, I lived here in Pennsylvania, in Westchester where you do, and I moved to San Antonio, Texas, those doctors there can immediately find out what I did and how I did and what I'm allergic to and how to continue with my work. So it is documentation, but it's proactive too. It's to allow me to determine next steps. The other thing is, say you look at testing, for example, state testing or portfolio of student work, and you go, gee, our kids seem to be having trouble with an area. Instead of just going, what do we do next, you can also work backwards, so to speak. So if you were an 8th grader, you took an 8th grade math test, and we look through the 8th grade in your school, and we go, my gosh, there's some problems here. The problems are cumulative. It's not really an 8th grade test. It's 8, 7, 6, 5, 4, 3, 2, 1, K. So we can go back and look at the maps and begin to say, we've left out things. There's some gaps here. Aren't we nailing this, or are we missing things? So that those who follow can have a better journey, as well as we're going to have to do something invasive right now because the 8th graders we have difficulties. So it allows you to do a lot of things. It allows you to, yes, have that history, but more importantly, take a hard look at what to do next, improve the journey of those who follow, update your work. You know, one thing in medicine is you want to have current medications. You want to be right on the cutting edge of what is the most thoughtful, well-researched practices. And in schools, we have a lot of schools that are dated. Kids are, you know, not everybody goes to a school like yours. Not everybody has teachers who are willing to work with more contemporary tools or ways of communicating. And mapping also is saying, are you, when you look at your curriculum, you should aggressively, and I don't apologize for that adverb, you should aggressively be looking at what year you're preparing your kids for. Mm-hmm. So one reason for our conference here is to look at, yes, let's look for gaps, let's look for repetitions, how do we help our kids? But it's also, hey guys, what century are we in? How could we take a hard look at that curriculum and make a difference? Mm-hmm. One other thing, you made an interesting point. If, as you probably well know, if you were a student in Paris, France, and you were a graduate or a medical student, and you were very interested in looking at a specific surgical procedure, it's very possible that you would be linked either through video conferencing or through some form of technology. You could watch that procedure go on, let's say, at Rochester, Minnesota, one of the best medical institutions, or Johns Hopkins, for example, or Columbia University in New York. You could see that from far away, and you could also share your findings with other students around the world who are looking at the same procedure. In a similar way, mapping, because it's global, it's literally all over the world, people can what we call export and import curriculum units. So I can share, I can go beyond even my school and expand my repertoire or what I draw from teachers far away as well as close by because of the electronic nature. So it's very different from the old ways of working, and I'd say technology is a formidable reason for that. Mm-hmm.